Hey everyone, so if you watched my last vlog on medical marijuana 2, you should have a little bit of an understanding about the science of it. We'll talk more about the practical application of what I expect my patients to go through, or at least the experience that you should be going through. So consider this a how-to on the use of medical marijuana for your disease process. And that's the first step, is to isolate and know your disease process. If you have a constellation of symptoms, it is important that you understand what's going on or what the major medical problem is. If you have not been to a doctor, get to a doctor. If you're not getting good answers with regards to what you're suffering from, then get to a specialist. But either way, you should have a list of the top 3 diagnoses that you're going into or you're having to deal with. Once you have a diagnosis, then you can develop a treatment plan. And everybody fares better when they have a plan. With regards to medical marijuana, you should have at least one of 40 diseases listed by the Illinois Department of Public Health to qualify for a medical marijuana card. That's an application process that your physician is supposed to fill out if they are comfortable with it and send off to the state. In my experience, it takes 1 to 3 months to get the card back to the individual for the final process of approval. Once you have a card, you can access the dispensary that you choose in your area. If you see the tutorial on medical marijuana, number 1, you'll see that the pharmacanist folks were nice enough to come to my fibromyalgia presentation and give a little bit of an introduction on how it can help with disease. But there are several dispensaries in the state of Illinois near you. I think the dispensaries are very valuable in that they usually have representatives that will help walk you through the process of the paperwork. Check out the testimonial by Mike on my medical marijuana 1 tutorial. It's usually very good to have a representative walk you through the process of how long to wait and when to get started. And that's where the healthy lifestyle comes in. The next step is usually once you establish your chronic disease process, the doctor pilot a program to get you to a healthy lifestyle change. Maximize on thinking, maximize on eating, and maximize on activity. And you've initiated that change. I'm assuming you're watching the video because you plateaued or reached maximum medical benefit on that plan. The next step would be to add the medical marijuana as an ingredient to your recipe to see if it can project you past your plateau. My suggestion is always to taper up, but not change anything of your lifestyle. If you make a change to your lifestyle and then introduce medical marijuana at the same time, you're not going to know what is causing the positive improvement. So maintain your lifestyle as is, add the medical marijuana in a stepwise approach, and then see how far you can go. I would want my patients to call me once they get the card before they go to the dispensary to come up with a plan on how to apply this to your own lives. If it's more of an anxiety issue or a sleepless night issue or just general problems with panic, then it's useful to have more of a THC dominant blend. And usually the best time for that is nighttime. If it's more of an inflammation problem, like in Crohn's disease, fibromyalgia trigger points, rheumatoid arthritis, a CBD dominant strain would be helpful. So I try to start out with very small doses. The smoked version versus the vaped version versus the oral version versus the topical version. Depending on what we're trying to take care of, I would always start out with the smallest dose. If it's more of an inflammatory problem, I try to go topical first, then maybe oral, then maybe vaporized, and then after that smoked. If it's an anxiety, insomnia, or panic attack issue, sometimes the inhaled versions are quicker in onset. They're also quicker in elimination. They leave your body fast. You might want to combine inhaled version in addition to oral version.